The Cetacaine is good because it has 3 ingredients, which is unique. Again, the fast onset compared to just using lidocaine is very good. And the fact that we can continue to move our procedures at a nice pace because we don't have to wait for the medication to take effect.
Where the more rapid 30-second onset time of Cetacaine is more beneficial, more useful and safer than the longer onset time of lidocaine. Every now and then we'll discover an airway that has difficulty, an airway that has anatomical properties which we did not anticipate. When that happens, the patient is already undergoing anesthesia. We need something that's going to rapidly control this patient's airway. And in order to do that safely, Cetacaine provides the rapidity of onset time that we need as opposed to lidocaine.
So some of the benefits of Cetacaine over lidocaine are ultra quick onset. And during procedures, it's important to get a good, dense airway block quickly. And Cetacaine offers advantage over lidocaine with a quick onset.
The main differences that between lidocaine and Cetacaine for us are the onset times and the duration. When we use a medication, we encounter different patients. Patients that have complex airways, patients that have surprises in their airways. Most of the patients with significant anatomical problems, we make sure to go to the hospital. But every now and then, someone comes on board and we discover a problem with an airway in terms of managing it. And in that point, we need to have the patient more awake and do things under a more controlled situation. And Cetacaine is the only medication we could actually use to accomplish that.
Cetacaine offers a longer duration due to the tetracaine. And so with lidocaine, the duration can sometimes be as short as 20 minutes, and Cetacaine can give you up to an hour. And I feel that that matches the procedural length well, and you don't typically have the drug wearing off during the procedure.
Now, Cetacaine has 3 ingredients, which allows for rapid onset of action within 30 seconds and a longer duration of action that allows the procedure to be completed. Lidocaine can take up to 5 minutes to work and does not last as long as Cetacaine. This could potentially be an issue as far as efficiency in the endoscopy unit.
Sometimes it's hard with the use of nebulized lidocaine or topicalized lidocaine to determine how much the patient has actually absorbed. One of the benefits of Cetacaine is you know where you're at. The package insert gives very clear instructions on the usage and the dosage of Cetacaine to minimize risk.
Patients prefer the direct administration of Cetacaine to the back of their throat, and they find that the thickness of the viscous lidocaine can be somewhat uncomfortable. You're relying on the patient to get it where it should be, as opposed to here, we put it where we need it.
For us in ambulatory surgery, there's really 2 predominant areas that we find most use for Cetacaine here. One is with head and neck surgery. Whenever we have to maintain an airway, establish an airway in a difficult patient or a patient that's going to be instrumented in terms of their airway, vocal cord nodules, things like that. Cetacaine allows us to anesthetize the area, establish an airway without significantly stimulating the patient, and also some analgesia for the surgeon to work under.
The FDA has issued a concern regarding the use of benzocaine and its relationship to methemoglobinemia. I think one thing we need to remember is that some of the issues have been from the over-the-counter product that then you kind of lose control of all of the people that are being exposed to this medication. In clinical practice, whether it be gastroenterology or anesthesiology, we are choosing our patients, and it's a defined population. In the course of my clinical practice, I've done at least 20,000 upper endoscopies, and I've had no incidents of methemoglobinemia.
I think the FDA plays a pivotal role in alerting clinicians to the risks of certain medications. And when I read that there was a rare risk of methemoglobinemia with benzocaine, it reminded me of how a lot of the medications that I use have some risk. But I still use those medications because I'm able to recognize the side effect and treat the side effect. One example would be fentanyl. We use fentanyl every day in our procedures. And even though it has a rare risk of chest wall rigidity, we still utilize it because we're able to treat chest wall rigidity. So the important thing is to know that fentanyl can cause chest wall rigidity, to recognize it, and treat it. And that allows that medication to be used safely.
I'm aware of the FDA's concerns regarding methemoglobinemia, and I believe that that's predominantly due to the fact that the medication is used appropriately and how the manufacturer recommends it be used, as opposed to over-the-counter use, which I believe has caused most of the problems. Whether it's hospital practice or ambulatory surgery, you always want to make sure you have Cetacaine available for the safety of your patients.